our comments have exploded through the roof. So there you go.
Good afternoon, Lancaster. Welcome to Lancaster Connects. My name is Ben McClure. I'm your host for the next hour here. We're going to have a great conversation, as we always do on Lancaster Connects. Today's guest is, we'll bring her on in a little bit, but we've got Andrea Murray from Union Community Care. We're going to talk about all of the wonderful things that their organization is doing right here in Lancaster County. If you've watched before, you know, again, Lancaster Connects is a way for my business, the business I co-own with my partner in business here, Jeff Giannakovo. He's unable to be here with me today, but we own Gardner's Mattress and More together. And of course, Gardner's, we help Lancaster wake up happy every morning. You see some, this way. You see some beds behind me here. That is our business. Gardner's has been around for 35 years now, ever since 1990. We've been helping Lancaster wake up happy every morning. But Lancaster Connects is our way to give back to the community. And what we do here on Lancaster Connects is to have conversations with nonprofits and charitable organizations, community benefit organizations, as we like to call them. Also other small businesses like ours that give back to the community in some way. So it's a way for us to highlight great organizations and great people doing amazing things for the Lancaster County community and beyond, as we'll hear from our guests today. If you want to watch past episodes, this is episode 190. I actually know that this time. A lot of times I'm guessing. 190 episodes in. We've got a kind of a milestone 200th episode coming up sometime here in June. You know, if you want to watch past episodes, Chris has it, our producer here at from Cast Ahead Productions, Chris Stone. He's got that up there on the screen, lancasterconnects.com/episodes, or hit the Lancaster Connects page, or type it into Google. At the top of the page, you'll see the episodes button. Click that. You can watch past episodes. Again, hundreds of great episodes or great conversations with amazing people doing great things in the Lancaster community. It's also a podcast. You can listen to it on the episodes page, but you can also call up Lancaster Connects in Apple Podcasts and Spotify Podcasts and other podcast players. You can also watch on the YouTube channel. Look, there it is right there. Hit the subscribe button, like us on Facebook, share this. The more people that can watch these episodes, the more impact these community benefit organizations can have. Again, hit the subscribe button and also give us a comment. Commenting on YouTube or Facebook, and you could be on the Lancaster Connects channel, you could be on the Gardner's Mattress and More channel. It's all connected. So any place you comment, it'll come in here. Chris will see it. I'll see it. Our guest will see it. Maybe you have a question for our guest. Maybe just like to say hello in the chat, or give our guest a shout out. We'd love to hear from you during the show. Love for the show to be interactive. So, just type it in there during the show, and there we go. And of course, you may be watching this after the fact. This is, of course, broadcast live, but it's not the only place. Again, you can watch it on the website, on YouTube, on Facebook, and maybe you won't comment during those moments that you're watching, but this is recorded for all time as well. So I'm excited, again, for today's show. It's a beautiful spring day here in Lancaster. The sun, I think, is shining. Last week was cold and dreary and wet, and I think we're in store for a beautiful spring vibe here in Lancaster. So it's just really, really cool. We'll talk maybe a little bit more about spring towards the end of the show. And of course, some of the things we've got going on here at Gardner's. But I think without further ado, we're going to bring our guest on. We've got Andrea Murray from Union Community Care. Andrea, welcome to the show. How are you?
Hi, thanks so much for having me. Doing good. Yes, enjoying that weather.
I know you've got a little bit of sunshine coming in here from your left shoulder. That's I mean, I have to kind of turn around and see it, but I'm leaving here after today's show, and I'm going to coach a baseball game tonight. It's our first regular season spring baseball game, and I couldn't be more excited. It's like last week would have been awful. this week is going to be fantastic. So, again, thank you for being on the show. I just want to properly introduce you here. Andrea Murray here is the Director of Community Impact at Union Community Care, which is a nonprofit healthcare provider that has been serving communities for over 50 years. That's pretty cool. And Union Community Care is reshaping healthcare by focusing on people, not profit, delivering accessible, inclusive, and high quality care that's grounded in the unique needs of local families. So I'm excited to hear more about your journey to Union Community Care, and of course, what Union Community Care, guys. It's like a tongue for me. Union Community Care. I want to know more about how they got started, what they do, the impact in Lancaster County. So that's what you're here to share with us. So again, thank you for being here, and let's learn more.
Great. Yeah, so Union has been around since actually 2021. Back in 2021, there was a merger between the Lancaster Health Center and Welsh Mountain Health Center. So both familiar names in Lancaster County, but that merger brought us together, hence Union. And we're founded on the basis that healthcare is more than just a service. It's a foundation for thriving families, really great workspaces, and resilient communities. And we always see those here in Lancaster County. And so we know that everybody, just like you said, in our community deserves the care that they need to get and stay healthy. We don't miss a beat when it comes to health. We know that family, friends, and work are really important to those that we serve. And so serving over 40,000 patients, actually a little over a little over 40,000 patients. They turn to us every day, and we're committed to providing that integrated and affordable and inclusive services to our patients and those that come in to see us.
That's amazing. So 40,000 people. That's across Lancaster, and I'm aware Lebanon, correct?
Correct. Yes, we're in Lancaster and Lebanon counties, and going to be doing some expansion here into Chester County as well this summer. And happy to share a little bit about that as we talk more today.
Yeah, that's cool. And so your journey to Union Community Care, you've been with them for just a little bit, right?
Yeah, just a little bit, but had some great experiences working with Union Community Care in the past. My background is in public health, and anything that's public health related is something that I'm always really interested in. I used to do some research in public health with Penn State College of Medicine. And when seeing what was needed in our communities related to the research, I knew that my next path was to be able to get out into those communities and make sure people knew what was available to them and how they could get the care that they needed. And so I serve as the Director of Community Impact here at Union Community Care. I get to lead initiatives that bridge healthcare and community needs together. I get to focus on health equity, the title kind of our podcast today and our message. I get to do outreach, which is what I absolutely love, and create strategic partnerships with other nonprofits, school districts, and policymakers throughout Lancaster County as well. And so, being able to improve social equity, access to healthcare, and build those relationships, it's super meaningful to me. I think everybody should be able to access healthcare. And so being in this position gives me the opportunity to make sure that everybody in our communities knows how to.
Awesome. So you have a number of facilities throughout the Lancaster and Lebanon community. Is that correct?
Yeah, we have over 21, well, 21 and counting.
Great.
So we will, and in those facilities, we provide all kinds of care services. We provide medical care anywhere from primary, pediatric, chronic disease management. We have urgent cares that are open to anybody in our community to visit, both in Lebanon and in Lancaster. We help with pregnancy care, school-based care. So in some of our school districts in Lebanon County, we actually have health centers that can
Okay.
be utilized by staff and students and community members. We also have a lot of great social support and specialty care coordination. We'll talk a little bit about that later too. Behavioral health, things that our communities need, like addiction treatment and psychiatric
Yeah.
care, brief intervention, and short-term counseling that we can provide to our patients. And then we also have pharmacies. So those pharmacies
Oh,
are
okay.
also actually open to anybody in the community too. And I'll be talking about one of our community members who benefited from our services and especially our pharmacies as well.
So you said all facilities or most of your facilities are urgent care facilities as well. So if that's a need that you have, obviously usually you need it immediately, right?
Mhm.
Urgently. Anybody can walk in and receive services there.
Correct. Yeah. So
Okay.
most of our facilities are our primary care
Yeah.
locations. We also have dental offices too, and so
Oh,
dental is something that's a big healthcare need in all of our communities, and so providing dental care and our family medicine here is really important. And like I said, yes, we have two urgent cares, one located in Lancaster and one located in Lebanon County as well. And those are open to anybody in the community, just not
okay.
our Union Community Care patients.
I
So
gotcha.
really nice, not a long wait here.
That's awesome. So let's dig in a little bit to some of the healthcare offerings that you have. I mean, we've just mentioned a couple, dental and urgent care, but maybe you can kind of walk us through some of the other services that patients can access, and what makes the model of care unique.
Yeah. So our model of care is we have an integrated model that streamlines care. So it's faster, simpler,
Hmm.
and it's more effective for patients, our providers, employers, and the whole community. And so when you're visiting a Union Community Care location, more than often you'll have more than one service located in that one location. So we have our primary care here that is as well as beside our urgent care and our pharmacy are all in the same location. And so you come into our offices, you see our phenomenal physicians and medical staff. They, check you out, manage your chronic conditions. If there is any, prescribe you medications. You can walk right next door to our pharmacy and get your medication before leaving in your car or walking home. And so it's really great that we can bring all of these and tie them together. We have some phenomenal staff here that works with our patients to kind of break down barriers as well. Barriers that you can see through chronic disease management, and also just things like needing transportation or food. We have some great folks that work here that help our patients, find those needs in the community. And so one of the things that we know in Lancaster County is not a lot of people have access to health insurance.
Hmm.
And so we have folks that will sit down with our patients and those in the community, and they'll help them get health insurance. They'll connect them to transportation. If even if their children need registered for school, those folks will help take care of the needs of those in our community, breaking down those
Hmm.
social determinants of health.
That's awesome because I mean, not to like knock other health facilities, but other health facilities aren't providing that level of care and maybe concern or help, right? I mean, they're not arranging transportation; you have to get yourself there.
Yeah,
I love. Oh, go ahead.
no, I was just agreeing.
Yeah, I love the fact that you have a pharmacy on site because most of the time I've been to the doctor, it's like here's your prescription. You have to go to where they ask you where you're going to get your medication, and you tell them wherever CVS or whoever, and then you go there, and then you wait for the medication to be ready. But that's extra time and of course gas money and or transportation that maybe somebody doesn't have. So the fact that you've got it all integrated there, kind of under one roof, under the maybe the 21 roofs. That's pretty cool. I think
Yeah.
that's really neat.
Yeah, we try to, break down those barriers and create opportunities for everybody and just ensure that everyone has equal access to
Yeah.
healthcare and the care that they need. We just need people to stay healthy.
Yeah. Right. Well, that's the key to life, right? So you serve a really diverse population. How do you ensure care is accessible for everyone? You even mentioned maybe this comes into play here that that your staff can, or the staff there can help work through insurance questions and things like that. So go ahead.
Yeah. So we take many steps towards ensuring that care is both culturally competent and accessible for
Yeah.
everybody. We work through community engagement. We have language access services, diverse staffing, and culturally relevant health education that's provided to everybody that visits us here at Union Community Care. One really cool program that we have here is the Plain Healthy program. And so we know that the Plain community is
Mm.
one of the communities that's really prevalent in Lancaster County. Our Plain Healthy community will actually visit those folks where they live
Oh.
through a mobile medical unit. And so our Plain Healthy program is one that's really popular here in Lancaster County.
So that's cool. So it's kind of like old school medicine where the doctor would visit the home. I mean, that's essentially what this is, right?
Yeah, yeah. And there's more information about that program on our website. And if have any neighbors or anybody that would prefer to receive their healthcare that way, Union has you know that available.
So extended beyond just the Plain community in that program. So if somebody's maybe not able to leave the home, you can potentially arrange
Yeah, we utilize the
service
mobile
from the house.
medical unit into some of more of our rural
That's great.
areas in Lancaster and
Oh yeah.
Lebanon counties, where healthcare might not be as attainable to them. And very shortly here, we should be rolling out our mobile dental unit as well. And so looking
Okay.
for ways to collaborate in the community with that dental unit too.
Very, very cool. Very, very cool. What are some of the biggest health challenges that you see in the Lancaster area?
Yeah. So, health challenges in Lancaster County and in the areas, like I said, there's high rates of those uninsured individuals,
Mhm.
shortages of healthcare providers.
Mm.
We always need some more healthcare providers in the central Pennsylvania region. And then also high rates of chronic diseases such as heart disease and diabetes. And so we here at Union try to help address these, obviously, through the healthcare and managing those chronic diseases. We have our medical care teams. They
Mm.
designed ways to partner with you to meet everybody's unique healthcare needs. And so with the chronic care and with personalized care plans, we create treatment plans, do specialist referrals, working with other healthcare providers here in the Lancaster area, other
Mm.
health systems, other clinics. We create those treatment plans, and we really try to figure out how to help those people that have those chronic diseases like diabetes and hypertension, kidney disease, heart disease, and others that might be prevalent here. What's really cool about Union is that we know that there's a shortage of those medical providers in the area. So what we really want to do is we want to figure out how um, to create opportunities for for those living in Lancaster County and other places to have hands-on training and career pathways to help develop
Okay.
term workforce in healthcare here.
That's awesome. And how are you helping with health insurance? How those conversations for somebody that doesn't have health insurance or may have limited resources to afford proper health care. What do those conversations look like?
Yeah, so we have our social support team here, and those folks work in our offices. Their services can be utilized by anybody in our community. And so if folks need help with just figuring out health insurance. Some of our patients lose their health insurance and
Yeah.
then are facing high costs when it comes to medications or if they have to visit the emergency room or stay in the hospital. And so through our social services here at Union Community Care, you sit down with one of our staff and you figure out what is the best insurance that will fit. Working on marketplaces through Pennsylvania and figuring out that best fit so that we ensure that you're getting the care you need and not coming because it's too expensive.
Right. And that sit down, I love that because I think there's a lot of conversation I think that can be had around health insurance. But if you're trying to arrange something for yourself and you call an 800 number and you're on the phone with somebody that's just not maybe understanding or not getting it, or you're not maybe you don't know what questions to ask, and you're not maybe getting the information you think you want to get. Your providers are literally sitting down with somebody and having a face-to-face conversation and making sure that the right path is being recommended. Am I getting that right?
Yeah, you're really getting that right. And I think what's really unique about Union is that when you visit our offices, you're not just seeing someone at the front desk, a nurse, in the room, and then your provider, and then you're leaving. You're
Right.
seeing so many others that are working inside our four walls to make sure that you're feeling the best that you can. And so anywhere from behavioral health to those social services, it's connecting you to one of our dental offices if you need a dentist appointment.
Yep.
And I think what's really interesting too, or what's really cool about Union is that not only do we help those that are, looking for insurance, but we provide care to anybody. So anybody with any type of commercial insurance, Medicare or Medicaid, or even if you're not insured and you don't have insurance, we don't turn anybody away from care here. And so what I usually tell people is that Union is a place that we, like I said, provide healthcare and don't worry about the profit. So even if you have commercial insurance, our care here is probably some of the best care that you can get in Lancaster. And if you're looking for something that's not as expensive, even those that are on commercial insurance, it's a great opportunity to put some money back in your pocket so you can do those fun things spring days.
That's awesome. So, and Chris might be able to bring up one of the things he had on the screen, probably from the website, was something about a sliding pay for services sort of thing. That sounds different than insurance. What is that about?
Correct. So like I said, nobody will leave without receiving care here. And so one of the options that we do have for our patients at Union Community Care is to utilize a sliding fee scale. It's based upon income that is self-reported during your appointment. And then those at our front desk and our billing department will help anybody be able to afford the care that they need based upon using that sliding scale. And so that is something that I just absolutely love, because sometimes, the cost is something that just scares people away from going to the doctor's office. And so we look for every avenue to make healthcare affordable to those living in our communities.
That's fantastic. So I know there's probably hundreds, maybe thousands of healthcare stories that we could share, of people that have benefited from the services offered at Union Community Care. Maybe you could share a story or two of somebody who's received services there and really Union Community Care made an impact in their healthcare journey. Go ahead.
Sure. So there is a story that I absolutely loved learning and reading about when I started here at Union Community Care. And that story was about Scott Rainier, one of our patients. And you can see this story on our Union Community Care website. He's a father, he's a grandfather.
There he is.
Chief, there's got him there, a chief engineer at a hotel in the Lancaster community. And he became a patient here at Union Community Care, and our care team taught him how to manage his diabetes. one of those chronic conditions that we see.
Yep.
And so, during that education, he was told that he was going to need injections of insulin daily to help
Right.
control his diabetes.
Which is super expensive, right?
Yes. And so, so down the road here, what ended up happening, unfortunately, is Scott lost his health insurance, and the cost of managing his diabetes, it skyrocketed.
Right.
And so with the prices of insulin soaring and without the coverage he had, he found himself struggling to afford that insulin.
Sure.
Paying $500 to $600 out of pocket a month to afford the medications. And so rather than saying, you need this insulin, so $500, $600 is what you're going to need to do to make yourself healthy. We didn't let him, try to navigate this on his own. And so we stepped in, Union Community Care stepped in to find an affordable option for him for health insurance. And that health insurance also helped him pay for those medications that he needed. And so there are community health resource coordinators, so our social service team, and those coordinators that you sit down with quickly reconnected him to insurance. And then that insurance, allowed him to have a $0 copay for his medication.
Oh, that's awesome.
So, yeah, right. That's amazing. And just to think about that burden that was sitting on him, that if I don't take this insulin, I'm going to be in the hospital. And that's what actually happened to Scott. At one point, he was at the ER because he wasn't feeling well, admitted into the hospital, came back to Union Community Care. We helped him get that insurance to not only see us, but then that insurance then could be used for those ER visits and his stay at the hospital as well. And so I think that's just the powerful thing about Union Community Care. It's just not hopping into a doctor's office and them writing you a script and then showing up to the pharmacy and saying, oh, well, your medication's going to be $500 this month. Even our pharmacist, if you do come into our pharmacy and say, I need this medication, they will sit down and the pharmacist and the pharmacist staff, the techs there, they'll help you find the best care and the best prices for your medications.
Yeah, that's awesome. So how would someone like Scott, who's in that situation, find Union Community Care? Because, often maybe you have your own provider and you're in that situation where, you lost health insurance, you can't afford the medication, you're just not sure where to go. How might someone like Scott find Union Community Care?
Yeah, no, that's a great question. So our website's up here on the screen. unioncommunitycare.org has all the information that you would need to find us and connect with us and make an appointment with us as well. You can do that through that, or you can call us. You can call 717-299-6371 to schedule appointments and find the location closest to you to be able to receive care that you need.
That's great. That's great. I know you mentioned at the top of the hour, you're connected with schools and other organizations. So let's talk about that a little bit. The other places that you're connected to, local organizations, maybe other businesses, schools, that who can bring patients to Union Community Care. And of course, you can offer services too. So let's talk a little bit about how you're connected there.
Yeah, this is one of my favorite things to do is go and visit school districts in Lebanon and Lancaster counties to learn about the population of students there, but also the population of their support at home too, and learning about the different needs from one community to the next. And here in Lebanon, the needs of those living in Myerstown, 30 minutes from Ephrata, might be completely different from those living 30 minutes in Ephrata. And so you find that every community needs something a little different. And so what we are finding in some of our communities is that access and timing and the need to have children be seen for certain milestone appointments or, sick visits was a little hindering on some parents that may only get a limited amount of time off of work at their job. And so having the ability to have these clinics in our school locations is just phenomenal, to be able for those students to be able to get the care they need right where they are every day.
So you're actually bringing medical services into the school facilities.
Yes.
That's amazing. That's really cool.
Yes. So in those school-based healthcare centers, it's a seamless, coordinated, affordable, and tailored healthcare to students and staffs. We are found in the school district of Lancaster, in Columbia Borough School District, and then the La Academia Charter School as well. And so we can provide healthcare to students and staff there. There's our information about our school-based healthcare on our website here.
That's awesome. So do students or parents need to sign up for care in advance? Do they know that you're coming? How does that work?
Yeah, so we work with those school nurses to have consent forms signed that children can be seen there at the schools. Things that we do at those clinics is we do well child checks. We can provide physicals, screenings, medication management, chronic disease management, vaccines, even women's health for those that are at the age that might need those services. And so it's amazing to be able to provide care for every child that needs it, and whether or not families have the ability to get them to see the doctor or not.
Yeah. And is that something you're providing to the school and families free of cost?
It works just exactly like they would be visiting one of our offices here.
Okay.
And so we work with families, whether they, again, have commercial insurances, whether they have Medicare, or if they don't have insurance at all, the sliding scale fee can be utilized in those areas too.
That's awesome. You use the word amazing. I think it's amazing. So let's talk about current initiatives you might have at Union Community Care, maybe events, outreach efforts going on that maybe the community can get involved in, either in or should know about.
Yeah, sure. So I like to say Union is always on the go. There is so much happening in Lancaster on any given day. And so as Union Community Care, we try to partner with other nonprofit organizations and attend as many of those health fairs, school events. We are actually going to have a team at the Race Against Racism on April 26th. And
I'll be there too.
There you go. And so you'll see us out and about wearing our Union brand very proudly as a team there.
That's great.
Other events that we attend are, we will be at the Lebanon YMCA for Healthy Kids Day on May 3rd. Always a great event here in Lebanon. And on our website, we have all of the events that we'll be, partaking in here over the next couple months. Spring is event season. And so right after I'm done talking with you here today, I'm going to head over to the Head Start Spring Fling.
There you go. Cool.
Blow some bubbles with those Head Start kiddos there.
That's awesome. So this is unioncommunitycare.org. I'm sure you have an events page or, community page or something like that. That is where Chris is here. You got a lot of events coming up. It looks like some fundraiser events too, which kind of segues into, how the community can help. Obviously, funding is important, I'm sure. Maybe you can talk about that, talk about some of the events specifically, if you need help with volunteers or help with, participants to sign up, 5K, for example. How can the community help Union Community Care?
No, great question. And I think that the number one thing that we always like to say is that if you love our care, share Union Community Care. And so that's number one. If anybody's watching or listening and you are a community care patient, Union Community Care patient, we ask that you just tell everybody about the experiences that you've had with us and what you enjoy about seeing from your care providers here at Union. We always, though, are are really focusing on our communities. And so donations to Union Community Care can be made by visiting our website. There is a location there to make a donation to our organization. Other things that we can think about as businesses, if there's a partnership between a business and us that we have the ability to see your employees. We can have discussions with businesses about making appointments available to your employees and providing care to employees as well.
That's pretty cool. So that's also information that somebody can find on the website, the unioncommunitycare.org website.
Yes.
And how about volunteers? Do you ever, I mean, obviously you have paid medical staff and health providers, but are there volunteer opportunities for the community to get involved?
Any of those community events that you saw on our page, we'd be happy to have anybody in our community come and join us. What a better way to learn about Union Community Care as we meet with those folks out in the community. So volunteers at our events are always beneficial. We do partner with folks that might be interested in the medical field. And so, a one day coming to see what Union Community Care is all about, seeing what a community health center is and how it runs. I love to give tours of our locations. So if anybody's interested in seeing what our care is all about at one of our locations, happy to share that with anybody.
And they can reach out to you directly, or
they can reach out to me directly. Yep.
And how can they get in touch with you?
Sure. The best is through my email, which is andrea.murray@unioncomcare.org, or we do have a contact us page on our website that you can utilize, and we check that all the time, and you can reach out there as well.
That's great. As you're talking here, as we're talking about Union Community Care, is this concept what you're doing here in Lancaster and Lebanon and soon to be Chester County? If you'd like to talk about that, we can. But is this kind of unique to Lancaster? Are there other counties and communities that have this sort of community-based healthcare approach?
Yeah. So organizations like ours are called federally qualified health centers, or FQHCs. FQHCs can be found throughout the state of Pennsylvania and throughout the nation as well, as opportunities to receive health care at an affordable cost and receiving great health care. So in Lancaster County, we are your federally qualified health center. Union Community Care is the community health center in Lancaster County. However, in other counties throughout Pennsylvania, you'll find other community health centers just like us. For example, Hamilton Health, which is the community health center in Dauphin County, located in Harrisburg. Okay. And so you'll find, other federally qualified health centers across the state of Pennsylvania. And we all like to partner together to learn a little bit about what care looks in those different areas. But I think what we pride ourselves on here in Union is that we don't, it's not cookie cutter care. We look at our communities, and especially the Lancaster community, and we know what's needed right here in our backyard.
That's awesome. So what are some goals? Well, first, you mentioned, and I just mentioned it, you're expanding into Chester County, I think Coatesville specifically, or you're opening a location there maybe this summer?
Yes. Yeah. And so we had the opportunity to partner, and we are now going to be the healthcare provider at the Alliance for Health Equity's Brandywine Center. And so starting in July of 2025, right across the border in Chester County, they'll have members of Chester County and in Coatesville area will have access to primary medical care, our maternal and child health services, dental care, behavioral health, and social support, all in that one space at 744 East Lincoln Highway. And so really excited about this opportunity to bring this type of healthcare and this model of healthcare into the Coatesville area. And, July can't come soon enough. We're really looking forward to being a part of that community.
That's fantastic. So Lancaster County, Lebanon, and Chester County, the western part of Chester County. That's really great. Anything maybe upcoming or for Lancaster County or Lebanon County for what you're doing in these communities?
So a lot of times you'll see us, like I said, out and about within the
Yep.
community and supporting our other nonprofits.
Yep.
But in the talks here, as I join the Union Community Care team to start some of our own events. So keep an eye out on
Great.
our website for some more of those community events that might be, right here at Union Community Care.
That's awesome. That's awesome. Have we missed anything? Do you want to share anything that maybe we didn't touch on about what Union Community Care offers or is all about? Anything else you'd like to share?
No, I just want to say thank you so much for giving
Yeah.
the opportunity to us to, share with everybody in Lancaster all about Union Community Care and how we can help those living in our community. Like I said, please reach out if anybody has any need or information or wants to come take a tour
Yeah.
of our facilities. And if you're thinking about finding a new place for your own healthcare, please check out Union Community Care because we have a lot of great things to offer.
Well, I love knowing about this because I know healthcare is a huge issue for a lot of people. People from all walks of life. Like you said, somebody could lose their health insurance because their employer made a change, or we've all seen our own healthcare bills. It can be overwhelming, and then of course you have all of the health concerns that people have, just the wide range of care needs and medication needs. If somebody is out there needing to decide between groceries and a life-saving medication, well, that's not a decision that they should have to make. Somebody should have to make. So knowing that Union Community Care exists and knowing that you have people there that can help walk the community through, those health concerns, the medication, the treatment options, and then of course, the affordability, the fact that you have affordable plans and you can walk through health insurance. It's just amazing. I knew a little bit about Union Community Care just through the little bit of research that I did, but I've never seen this in action. So this is really, really cool. I'm happy that you were able to be on the show and, really excited to share it with the Lancaster community. So anything else you'd like to kind of wrap up with about Union Community Care?
No, like I said, again, thank you. And, I always get excited when someone learns about us
Yeah.
or hears about us. But the other thing too that I'd be remiss if I didn't mention is
Yeah.
if there's anybody listening or watching that is another nonprofit organization or
Mm.
a pivotal service to our community and you want to learn more about Union Community Care or you want us to learn about services that you provide to the Lancaster community, again, please reach out to me through email or contact us through the website. We'll come to you, learn about the services that you provide because there's always opportunities for us to connect our patients with other organizations in the community as well.
Well, that's so cool. I'm glad you brought that up because I even mentioned it to you in the pre-show. We had Real Life Community Services on, I think that's their name, up in Denver. Rod Redkay, shout out to Rod. He's a 2-time guest on this show. Last time he was on with his daughter, and he's mentioned Union Community Care. And it's cool doing this. Just having interviews with, again, amazing people doing awesome things in the Lancaster community to see how you're all interconnected. And it's not, you don't have just an organization over here doing their thing and an organization over here. You need to help each other out, right? And you do. And we love to see those connections being made, whether it's through our show or, being talked about on this show. It's really cool to see how this community really kind of comes together and helps each other out. So I'm glad you brought that up.
Great.
So thank you again for being on to talk about Union Community Care. I've got a few more questions for you, Andrea, if you have
Sure.
a few more moments here for us. So we like to get to know our guests a little bit better. We call it our connection cocktail. So we mentioned spring at the beginning of the show. You've got some beautiful sunshine coming in over your shoulder there. What's your favorite season? And maybe we'll start there.
Yeah,
What's your
no.
favorite season?
I was chuckling inside a little bit because you mentioned baseball. So
Okay, yeah.
we're a baseball family as well,
That's,
and so super excited for the Phillies season.
all right.
And the Stormers, going to see those Lancaster Stormers as well.
Awesome.
We love the Phillies. We travel with our son who plays on a few baseball teams, and then
Yep.
we coach our daughter's t-ball team, which is
That's so cool. That's so cool. So yeah, I've already been to 2 Phillies games. I went to opening day and I went to a
Nice.
game last Sunday that was a fantastic game against the Dodgers, but it was like cold and rainy the whole
Yeah.
time. But they won. It was a great time. I was there with a neighbor and his son and my son. So it's a rainy day at the ballpark is better than a good day or a nice day doing anything else. I think there's a quote something like that there, right?
Yeah, we had our first rec league game last week, and
that's cool.
in that cold. So spring baseball.
T-ball is so much fun. I mean, just getting the kids to swing a bat and run to first, and run the right direction and run to the base. That's all you can do sometimes.
Organized
chaos. Yep. Well, that's cool. So, what do you like about spring? Maybe besides baseball.
Yeah, no, I love baseball. I love the ability to just get back outside. We have lots of animals in our home, so 2 dogs and a cat that want to get outside too, and so being able to spend time and I was thinking about like, what do I like to do when I unwind? I laughed, right? Because I have a 9-year-old and a 6-year-old. What's unwinding? But spring means closer to the summer where we get to spend some time down at the Jersey Shore throughout the summertime and take some time off and enjoy just being with our families down there.
That's cool. Do you have a spot in the Jersey Shore that you go?
Yeah, we love Sea Isle City, New Jersey.
There you go. Very good. Very good. We're a Cape May family. We always
go. Not that far. Not that far.
Yep. They're all right there. That's awesome. Well, that's I mean, that season is right around the corner, so that's cool. A question we like to ask all of our guests is everybody has an opinion on food and maybe their favorite restaurant. So do you have a favorite restaurant you'd like to share with us?
I love visiting the Southern Market. Such a cool spot.
Yeah.
Yep. So it's like all those restaurants in one, and you can make whatever selection you want. It's a great opportunity to try different cuisines, and the entertainment that's there is always great. So I'd say if I'm going to go out, I want to go to the Southern Market.
That's cool. I've been there a few times. I was there for a trivia night one time, which was a lot of fun because, a lot of times when you go someplace, you're limited to the menu. That's just that, but everybody can kind of go get their own thing, and there's a bar there, and it was fun. So that's cool. You're not the first person to share Southern Market. You're probably not the last. So that's cool. Thanks for sharing.
Sure.
Well, again, thank you, Andrea, for being on Lancaster Connects, for sharing about Union Community Care. Again, Andrea Murray, Director of Community Impact, all the wonderful things that Union Community Care is doing. You can find that at unioncommunitycare.org. And of course, you can connect with Andrea right there on the screen. Her email address was on there. Andrea, thank you so much for being on the show, and have a great afternoon.
Thanks so much.
Yep. We'll see you. All right. Well, that was a great conversation there. I mean, all these conversations are great. Healthcare, like I mentioned, talking about it on the show, it's a complicated subject. Obviously, people have situations that maybe it's a financial situation or a health concern, and they just want to get healthy, and want to talk to somebody who's going to give it to them straight. And Union Community Care is that place to, talk about health insurance, talk about care, talk about affordable pharmaceuticals, whatever the health question is, Union Community Care can answer it straight and quickly, and that's and affordably, and that's so cool. So again, Gardner's Mattress and More is the sponsor of Lancaster Connects. It's the business that I co-own with my partner here at Lancaster Connects and at Gardner's. Jeff Giannakovo. So I'm just going to mention Gardner's Mattress some more, talk about them for a little bit. Again, we help Lancaster wake up happy every morning. We have some amazing customers that have supported our business for the last 34 years. I'm sorry, 35 years. Man, it's sometimes hard to remember that it's 2025. Gardner's was started in 1990. So been around for a long time here in Lancaster, helping people sleep better every night. Chris is scrolling through our Google reviews there. We've got some amazing customers. It's really humbling to get some kind words from our customers when they feel they've gotten 5-star service from us. So thank you to anybody who's ever bought a mattress from us in the past. And of course, especially to those who go online and say some special words there. I wanted to highlight a review a testimonial. We get people that mail back testimonials. So we had one come back recently from somebody who has a home in Lancaster, but also has a home in Sullivan County, about 2.5 hours away. They, had bought a mattress from us and came back, but they just assumed they were kind of getting ideas for their house that's 2.5 hours north, and they were just assuming hey, I'm just getting some ideas, we're that far away. I'm sure you don't deliver up there. And we're like, yes, we do. Not that we're up there all the time, but if we can get there and back in a day. So typically anywhere within a 3-hour or so radius around the store, we will gladly, deliver a mattress, bring the old one back. If we can kind of do it round trip within a day, Gardner's is your store. So, we mentioned the Jersey Shore. We've been down to the Jersey Shore. We've been to the Delaware shoreline. We get down to Maryland and DC. We get as far west, not quite out to Pittsburgh, but we get out that direction. And of course, northern PA, of course, Harrisburg and beyond, north of Lebanon County, even out to Bucks County and the middle of New Jersey. So, anyway, they were kind of blown away that we would be willing to do that. And, our take is, hey, we can help you sleep better and wake up happy here in Lancaster. We can help you do that at a home that's 2.5 hours away as well. Why not us, right? Anyway, they mentioned our delivery team. The delivery guys this week in Lancaster were friendly, polite, and well-informed about the product. Gardners are exceptional to deal with from a customer standpoint. So thank you to Robert and his family who bought a second mattress from us and, again, had it delivered a decent distance away. So that is something, again, that we will do here at Gardners. We aim to please with our service and our product, and it's the way it's always been. It's the way it's always going to be here at Gardner's. So, again, thank you for watching Lancaster Connects. Again, Lancaster Connects, if you're just tuning in or, kind of jumped in after we got started, it's our way of giving back to the Lancaster community, to have conversations with, again, amazing people like Andrea from Union Community Care, to have these conversations with people who are giving back to the community. Maybe they work for an organization, a community benefit organization that provides services to the Lancaster community and beyond. Maybe it's a small business like Gardner's that has a way to give back. We love to have those conversations. It's a free show for our guests to be on. It's, we don't charge a thing. Again, Gardner's sponsors this show. We'd love if you're watching and you have a story to tell. If you're one of those people that represents those organizations, we'd love to have you on the show. Go to lancasterconnects.com/guest. Up at the top of the page, you'll see the guest tab. Fill out the simple form that's there. Tell us who you are, why you'd be a good fit for the show, of course, who you represent, and we'll get you scheduled onto the show. I think right now we're booked through May and into June, so we're looking for some great summer guests. This is a great opportunity if you have an event coming up. Maybe you have an event in summer or towards the end of summer or early fall, and you'd like someone to promote that event for you. That's what we do. We'd love for you to be on the show, tell your story, talk about the event. And again, if we can get more eyeballs to you and more fundraising efforts, visibility for your fundraising efforts, we love that. So again, thank you all for watching. Hope everyone has a great afternoon enjoying this Lancaster spring sunshine. So again, Till the next connection, we'll see you later.
Comments of this floated through the roof. So there you go.